If your legs feel heavy by mid-afternoon, if you've noticed veins darkening on the backs of your calves, or if you've been jolted awake by a cramp that seemed to come from nowhere, stay with me for the next few minutes, because what I'm about to share could change the way you think about your circulation for the rest of your life. I'm Dr. James Revealio, and welcome back to Science of Wellness. Today we're covering 4 vitamins that the research community has repeatedly connected to vein wall strength, valve function, and healthy blood flow in the legs. And I'm going to save the most clinically important one for last. The one nutrient that, in my view, does more for long-term vascular flexibility than any of the other 3. But before we get there, I want you to run through 4 warning signs with me. If even one applies to you, your veins may already be working harder than they should. The 4 warning signs your veins are sending you: warning sign 1, heavy, tired legs by the middle of the afternoon. Not after exercise, not after a long walk, just from an ordinary day. By 3 or 4 o'clock, your legs feel like they're dragging. Most people write this off as simple fatigue or just getting older. But from a circulatory standpoint, that heaviness usually means one specific thing: blood isn't returning efficiently from your lower legs back up to your heart. The one-way valves inside your veins are supposed to push blood upward against gravity with every step you take. When those valves weaken, blood and fluid begin to linger in the tissue of your calves and feet instead of moving on. That heaviness isn't tiredness. It's your circulatory system falling behind schedule. Warning sign 2, veins that look darker, more raised, or more visible than they used to. Take a look at the backs of your calves and behind your knees. Blue or purple lines that weren't there a year ago, or veins that now sit noticeably closer to the surface of your skin, are a visible sign of rising venous pressure. The vein wall is stretching under a load it wasn't built to carry, and it's losing elasticity as a result. Once a vein bulges outward like this, the valves inside often can't close all the way, which allows blood to flow backward and pool in small pockets instead of continuing toward the heart. Warning sign 3, restless legs at night, or cramps that wake you from sleep. If a sharp cramp has ever snapped, you awake at 2 or 3 in the morning, or if lying down triggers an almost uncontrollable urge to move your legs, that isn't random. During the day, every step you take helps push blood upward. The moment you lie flat, that gravitational assist disappears. If your venous system is already under strain, the muscles in your lower legs can end up under-oxygenated, and they respond with cramping, spasm, and that restless discomfort that keeps you from settling into sleep. Warning sign 4, ankle swelling that builds as the day goes on. Your shoes fit fine when you put them on in the morning. By evening, they're snug. Your socks leave deep marks that take minutes to fade. This is peripheral edema, fluid escaping from weakened veins and settling into the surrounding tissue. If you press a thumb into the swelling and the indentation lingers for several seconds, that's something a physician would want to know about. It's a sign your venous return system isn't keeping pace with demand. If you recognized even one of those 4 signs, keep watching, because what follows isn't guesswork. These are nutrients that research has linked to stronger vein walls, better valve function, reduced vascular inflammation, and healthier day-to-day circulation. Vitamin 1, magnesium, the mineral that lets your veins relax. When people think about vein health, magnesium is almost never the first thing that comes to mind. Vitamin C, maybe. Iron, sometimes. But magnesium may be one of the most overlooked minerals in vascular health, and here's the reasoning behind that. Your veins aren't rigid pipes. They're lined with smooth muscle that has to contract and relax in a coordinated rhythm to help move blood back toward your heart. Magnesium is central to that relaxation phase. Without enough of it, those muscle fibers can stay in a partially contracted state. The vein wall becomes tight and less able to widen when your body needs more blood flow through it. Picture a garden hose. When it's relaxed and open, water moves through freely. Now imagine someone stepping on it at random points along its length. The flow backs up, pressure builds behind the obstruction, and the hose starts to bulge at its weakest spots. That's a reasonable way to picture what happens inside veins that aren't getting enough magnesium. Magnesium is also frequently discussed in connection with nighttime leg cramps, which brings us right back to warning sign 3. If that one sounded familiar, insufficient magnesium intake may be part of the picture. Where to find it? Pumpkin seeds are one of the most concentrated food sources of magnesium you can eat. Dark chocolate at 70% cacao or higher is another strong source. Spinach, Swiss chard, almonds, and black beans all contribute meaningful amounts as well. How much you need? For adults over 60, the general daily target sits between 320 and 420 milligrams. A quarter cup of pumpkin seeds alone gets you close to half that amount. One caution: if you supplement beyond what your body needs, digestive upset is the most common side effect. Magnesium oxide in particular is poorly absorbed and the most likely culprit. Magnesium glycinate or citrate tend to be better tolerated. But food first, always. Your gut absorbs magnesium from whole foods more completely and more gently than it does from an isolated capsule. Vitamin 2, vitamin D. Calming the inflammation you can't feel. Almost everyone connects vitamin D with bone health, and that connection is accurate. It's just incomplete. What matters just as much for your legs is vitamin D's role in regulating inflammation inside your blood vessels. When vitamin D levels drop below an optimal range, the endothelium, the paper-thin layer of cells lining the inside of every blood vessel, becomes more vulnerable to chronic, low-grade inflammation. You won't feel this happening. There's no pain signal attached to it. But over weeks and months, that quiet inflammation can weaken the vein wall, reduce the flexibility of your venous valves, and create the exact conditions where blood flow slows down, pools, and clot risk edges upward. Here's what makes this especially relevant after 60. Your skin becomes measurably less efficient at producing vitamin D from sunlight as you age. Around age 65, your skin generates roughly a quarter of the vitamin D it produced at 25, given identical sun exposure. Combine that with the fact that many older adults simply spend more time indoors, and deficiency becomes very common in this age group. Where to find it? Salmon, sardines, mackerel, and egg yolks from pasture-raised hens are among the best dietary sources. How much you need? Most guidance for adults over 60 points to at least 600, 800 IU daily, though your physician may recommend more depending on your levels. A simple 25-hydroxy vitamin D blood test, done annually, can tell you exactly where you stand. If your result comes back under 30 nanograms/ml, that's worth a conversation with your doctor about whether supplementation makes sense for you. 2 vitamins down. And these next 2 are, in my experience, the ones most directly tied to the visible problems so many people over 60 deal with: varicose veins, spider veins, and stubborn end-of-day swelling. Stick with me. Vitamin 3. Rutin. Reinforcing the smallest vessels in your body, this is a nutrient your doctor has probably never brought up, and yet it may be one of the most relevant compounds for anyone concerned about how their leg veins actually look. Rutin is a bioflavonoid, a naturally occurring plant compound that belongs to what's sometimes called the vitamin P family. Its most studied function is strengthening the walls of capillaries, the smallest and most delicate blood vessels in your body. When capillary walls become fragile and overly permeable, fluid seeps into the surrounding tissue, local inflammation rises, and the visible signs of vascular strain start to show up on the skin's surface. Rutin works to reinforce those walls, reduce that permeability, and help keep blood and fluid where they belong, inside the vessel. Think of capillary walls like the mortar holding a brick wall together. The bricks themselves might be perfectly solid, but if the mortar between them crumbles, the whole structure starts to leak and eventually gives way. Rutin is part of what keeps that mortar intact. Research on bioflavonoids like rutin has associated them with reduced severity of common varicose vein symptoms: leg heaviness, swelling, cramping, and that restless nighttime sensation we talked about earlier. Where to find it? Buckwheat is the single richest dietary source, and despite the name, it isn't related to wheat at all. It's a seed. You can eat it as groats, use buckwheat flour, or find it in specialty teas. Asparagus is another strong source. Green tea contributes meaningful amounts, and the white pith just under the peel of citrus fruits. The part most people peel away and discard is unusually concentrated in rutin. Next time you eat an orange, don't be too quick to strip that white layer completely. Typical intake. In research settings, doses generally range from 500 to 1,000 milligrams daily. Rutin is usually well tolerated, but if you're on blood thinning medication, talk to your physician before adding it, since it can modestly affect platelet behavior. Vitamin 4, vitamin K2, the one I consider most important. And now we arrive at the vitamin I told you about at the very start. The one I consider the most significant of the four for long-term vein protection and overall vascular resilience after 60. This one doesn't just ease symptoms. It addresses one of the root mechanisms behind vascular aging itself. I need to be precise here, because there's a distinction most people have never heard. When someone says vitamin K, they're usually picturing vitamin K1, found in leafy greens, which is mainly involved in blood clotting. Vitamin K2 is a different compound entirely, and for vein health, it may matter even more. Vitamin K2's job is to direct calcium to where it actually belongs, your bones and teeth, while helping keep it out of places where it causes harm, particularly the walls of your arteries and veins. As you age, calcium can gradually deposit along the inner lining of your blood vessels, a process known as vascular calcification. This is one of the central reasons vessels lose flexibility over time. Calcified vessels become stiffer, blood pressure tends to climb because the vessel walls can no longer absorb the force of each heartbeat. And in the leg veins specifically, valves that need to stay soft and pliable to open and close properly can become rigid instead. Once a valve stiffens, blood starts flowing backward, pooling lower in the leg, and the cycle of swelling and visible vein damage accelerates. Vitamin K2 helps interrupt that process. It activates a protein called matrix GLA protein, which binds to calcium and prevents it from attaching to vessel walls in the first place. Without enough K2, that protein stays inactive, and calcium is free to accumulate unchecked. With sufficient K2 on board, your vessels are better equipped to hold on to their flexibility. Where to find it? Natto, a traditional Japanese fermented soybean dish, is the most concentrated food source by far. I know it's not for everyone's palate, but even a few servings a week go a long way. Aged cheeses, Gouda, Brie, Edam, contain meaningful amounts, and so do egg yolks from pastured chickens, chicken liver, and grass-fed butter. How much you need? The research on ideal daily intake is still evolving, but most studies showing vascular benefit have used somewhere between 90 and 200 micrograms daily. An important note, if you're on warfarin or any other anticoagulant, vitamin K in any form interacts with how those medications work. That's a conversation to have with your physician before making any changes to your diet, bringing all four together. Here's what I find most compelling about looking at these four nutrients as a set rather than in isolation. Together, they cover the problem from every angle. Magnesium relaxes the smooth muscle in your vein walls so blood can move without unnecessary resistance. Vitamin D helps quiet the chronic, low-grade inflammation that slowly wears down those walls from the inside. Rutin reinforces your capillaries and reduces the leaking that leads to visible vein damage. And vitamin K2 keeps calcium out of your vessel walls, so your veins and valves retain the flexibility they need to function properly. The most reliable way to get all four isn't a fistful of supplement capsules. It's a daily eating pattern that delivers them naturally, consistently, and forms your body already knows how to absorb. At breakfast, lean into magnesium and vitamin D, 2 eggs from pasture-raised hens, poached or boiled, a small handful of pumpkin seeds, a piece of fruit, warm water with lemon. That single meal covers a meaningful share of both nutrients and takes less than 5 minutes to put together. At lunch, focus on vitamin D and rutin, grilled salmon or sardines, a generous serving of asparagus, a side of buckwheat, and a cup of green tea. This pairing delivers both nutrients in highly usable forms and helps reinforce your vein walls through the afternoon stretch, right when that first warning sign tends to show up. At dinner, keep it lighter and center it on vitamin K2, a small portion of aged Gouda or Brie, a spinach and walnut salad with extra virgin olive oil, and herbal tea to close things out. This supports your vascular system overnight, while your body does its deepest repair work. The vein protection smoothie. And now, the recipe I promised you at the start. One daily habit that brings together rutin, magnesium, vitamin C, and anti-inflammatory compounds in a single glass. I recommend it every morning on an empty stomach for the first 14 days, then 3 to 4 times a week after that to maintain the benefit. Into your blender, 1 cup of fresh spinach for magnesium and folate, 1 stalk of celery, which supports healthy fluid balance, half a green apple or 1 small kiwi for vitamin C, a thumbnail-sized piece of fresh ginger, a 1/4 teaspoon of ground cinnamon, 1 tablespoon of buckwheat groats, your direct source of rutin. Blend it all with 1 full glass of filtered water. Don't strain it. Drink the whole blend with the fiber intact, since your body absorbs these nutrients more efficiently when that fiber matrix stays in place. Take it first thing in the morning and wait 20 to 30 minutes before eating anything else. Give it 2 weeks and pay attention to whether your legs start feeling lighter, whether that afternoon heaviness starts to ease, and whether the end-of-day ankle swelling begins to recede. 4 daily habits worth keeping alongside these 4 vitamins. 4 simple habits go a long way. Walk for at least 20 minutes every day. Movement is the most fundamental circulatory support there is. Avoid sitting for more than 45 minutes at a stretch without standing up and rotating your ankles a few times. Elevate your legs for 10 minutes before bed to ease venous pressure. And drink enough water throughout the day, since dehydration thickens the blood and raises clot risk before you go. One last thing that matters more than anything else in this video. If you're taking medication for blood pressure, diabetes, heart disease, or anticoagulation, do not stop or adjust that treatment based on anything I've shared today. Everything here is meant to work alongside your medical care, not replace it. If you're on warfarin or any blood thinner, keep your physician in the loop before making dietary changes. Vitamin K especially. If someone in your life mentions their legs ache and they can't figure out why, a parent, a sibling, a friend, send them this video. Good information, landing in the right hands at the right time, genuinely changes lives. If you haven't subscribed to Science of Wellness yet, now's a good time. And turn on notifications, because every week I bring you evidence-grounded content built to help you live longer, stronger, and more independently. For everyone who's been with this channel for a while, thank you. Thank you for watching, for sharing, for leaving your comments. It's what keeps me researching and bringing you the most relevant information I can find. May your legs carry you well. May your veins stay strong and clear. May your heart beat steady. And may you have the health and the energy to enjoy every day with the people you love. Take care of your veins the same way you take care of your heart. Dr. James Revealio, Science of Wellness.